I'm Holly Cohen, a licensed independent broker, and welcome back to Preferred Medicare. Today's video is we're breaking down some of the biggest changes coming our way in 2025. We're also going to dive into the most popular and value-worthy Medicare supplement plans. I'll explain how the different Medigap letters compare. Plan G, Plan N. We are seeing a wave of Medicare Advantage plans being canceled. Additionally, healthcare systems are refusing to accept these plans for 2025. Hospitals and doctor networks are struggling to keep up with the cost of care. And some insurers are deciding that it may no longer be financially viable for them to operate in those certain areas. On top of that, with the new $2,000 cap on Part D prescription drug costs coming into effect next year, Medicare Advantage plans, they're making up for the losses by cutting the extra benefits that were so widely advertised in previous years. So what does this mean for you? It means that if your plan is being canceled or you're seeing fewer benefits in 2025, maybe it is time to explore your other options. And that's where I can give you some information. So let's first talk about your options if your Medicare Advantage plan has been dropped. One of the biggest things to understand is that there are two main ways to be on Medicare. You can stick with original Medicare, which is your Part A and Part B, and add a Medicare Supplement Plan, also called a Medigap plan. Or you can enroll in a Medicare Advantage plan, which actually replaces your Part A and Part B coverage. And you receive private coverage from an insurance company to manage your Medicare. And as we are seeing in 2025, many plans are being cut back or canceled completely or dropped by your doctor's office or your hospital system in your area. If you are a person that's currently on a Medicare Advantage plan and you're looking to switch back to original Medicare, meaning you can go to almost every doctor and every hospital in the United States that takes your red, white, and blue Medicare card. Remember, original Medicare only pays 80%. So it's that 20% gap that is difficult to fill for various reasons. If you're coming from a Medicare Advantage plan, typically you will have to go through a medical underwriting process to be eligible for a Medigap plan, such as a Plan G or a Plan N. If you're currently on a Medicare Advantage plan and either your plan has been canceled or your doctors and hospitals have dropped it, or you simply just do not want to be on Medicare Advantage and you want to get back to original Medicare and enroll in a Medigap plan, remember, most times you will have to go through between 26 to 30 medical underwriting questions, health questions, you had heart attack, stroke. There's many health questions. And once an agent like myself puts in your application, it could be declined for coverage based on health. Everyone has a personal enrollment window when they first start onto Medicare Part B. They have 6 months before and 5 months after the Part B effective start month in order to not have any health questions. Therefore, if you're currently on a Medicare Advantage plan and either your plan has been canceled or your doctors and hospitals have dropped it, or you simply just do not want to be on Medicare Advantage and you want to get back to original Medicare and enroll in a Medigap plan, remember, most times you will have to go through between 26 to 30 medical underwriting questions, health questions. So as I just stated, the two most popular plans for 2025 are letter G and letter N. Plan G has been the go-to for many years, but Plan N is gaining popularity for 2025 because it offers really great value for the cost. Plan G covers nearly everything original Medicare doesn't cover, except for the annual Part B deductible, which currently for 2024 is $240. After you pay that, he picks up 100% of your Part A and Part B costs. Plan N works a little differently. It's less expensive. You will have to pay certain copays, possibly. So you might have to pay up to $20 for a doctor's visit and up to $50 for an emergency room visit. And you also may be responsible for something called the Part B excess charges in some states. Let's look at the cost comparison between Plan G versus Plan N. The average monthly premium for Plan G in 2024 is around $150 to $180, depending on your age, location, and your gender. A Plan N, on the other hand, can be much more affordable, with premiums averaging around $100 to $130 per month if you're relatively healthy and don't see the doctor often. Plan N could be a more cost-effective option. So the question is, do you prefer to pay a higher monthly premium with a Plan G and have nearly no out-of-pocket expenses, or would you rather pay a lower premium with Plan N and deal with some of those copays and the possibility of the Part B excess charges? If you have any questions, please feel free to comment below or give us a call. We're happy to help. Here are your options. You can switch from one Medicare Advantage plan to another if you aren't happy with your plan, or if your current plan has been canceled, or if your doctor's office has dropped your plan. You can go back to original Medicare and enroll in a Medigap plan like a Plan G or a Plan N. But remember, you will most likely have to go through the health underwriting questions to be approved by a Medigap insurer. Remember, if you've just started Medicare Part B, you have that one-time open enrollment period where Medigap insurers cannot ask health questions 6 months before and 5 months after your month that your Part B began. If you've had Part B for more than 6 months, you will need to go through medical underwriting to qualify for any Medigap plan in almost all the states in the country. At Preferred Medicare, we're here to help you navigate these options and find the plan that's best for your health, for your budget, and most of all, for your peace of mind. If you are affected by Medicare Advantage cancellations or just want to see if you can save money on your current Medigap premium, call us or visit our website for more personalized information. PlanGfinder.com is our website. Our phone number is 855-265-6334. Thanks for watching today, and don't forget to like and subscribe for more Medicare updates. Take care, and as always, please be well.